can put a blanket over the person. This is obviously a very thin blanket, but if you're working with a blanket, I would just fold it back first, and then I'll show you how to do the draping for the leg. If you have a space heater, that's really nice because it warms up the space. You can also use maybe you could use like a hot water bottle, or you could use a heating pad, something like that, which could be really effective too. Sometimes, like when I'm working on the person's back, I'll just start with like a heating pad on the back just to warm things up. And then once I'm working on the back, I'll put it like on their feet or the back of the legs or somewhere, just to keep them warm, as long as that feels good to them. Okay, so I have this sheet. I'm just going to gather it up like this, and I'm going to lift at the knee with this hand and reach under with this hand and grab the sheet and pull it up. So as I lift the knee, I'm going to reach under here, reach under with this hand and pull it up. And what that does is it just makes a nice drape on the inside of the leg. And then I can fold this back as much as I need to expose the hip area here. Probably not the best area to be doing video since we didn't ask permission.
That's fine.
Do we have your permission, Gene?
It does, yeah, it's totally
You're okay.
fine.
All right.
A million people are going to see it on YouTube.
Alright,
He'll be
thanks,
famous.
but-
Look at them thighs.
So you can see I've got the hip area uncovered here, but the patient feels draped because everything midline is draped. So, and that's important for the person to feel secure and relaxed. And are you warm enough?
Yeah,
Okay.
I'm great.
Often people like to go from like the foot all the way up to the hip, so everything feels like it's all connected. Sometimes people will even go from the foot all the way up, like the side to the shoulder. And that's easier to do if you're in a more private setting where you can, undrape maybe to like the middle of the back, where you can really get everything feels connected, and that's nice.
Dr. Mather, are you exposing enough just so you can reach like glute med?
Yeah.
Okay.
So I'm actually going to start at the calf here. And I had a little conversation with Jean first about, some people are more sensitive with body hair in terms of like, if I'm going this way, I'm obviously pressing the body hair away from its natural growing pattern. For some people that might be more irritating than other people. Having more oil obviously allows for more, lubrication for smoother massage. So if you are working on somebody who has a little more body hair, you can use a little bit more oil. If the person was very sensitive to having the hair go the opposite direction, if it just felt really uncomfortable to them, you could effleurage away from the heart, but I would just do it very lightly. So you could actually work down. I would just do it lightly, and then do your Petrissage or whatever, like that. Okay, so Gina's given us permission. So I'm going to start with Petrissage, and Petrissage on the calf is just seems like the perfect area because you can really just lift that whole calf muscle and knee muscle between your hands. And so, good time to practice your Petrissage. So if you can see, my hands stay in contact, stay on the skin, and hands are basically just moving opposite directions. As one moves one way, the other one moves the other way. I was talking to somebody in the Tuesday night class. I was saying it's kind of like Tai Chi or Qigong when you're doing sort of like circling exercises, right? So you have that opposite motion in your hands. Kind of lifting the muscle up. Is this pressure okay?
Yeah, that's good.
And the circular friction, you'll also hear the term fulling. So this kind of, I don't know if it's any different than circular friction, but I've heard this term fulling on the extremities is a type of circular friction. I have my hand just supporting here on the side. My thumbs are doing the work. I am working my way away from the heart, but I'm pressing my thumbs toward the heart as I'm doing this work. I work the center of the calf, and then my fingers work the sides of the calves here, and then the thumbs are just quiet while they're doing this. The other thing that you can end up doing is making little knots in the hair. So you want to avoid like doing circular friction in one area for too long, because you can end up with little knots. The next stroke we call windshield wiper, and you'll see why in a moment. It's called that. So I just lift at the ankle here, and there's a natural crease here at the back of the knee, and I'm going to use my open hand here just to, it'll just fits right perfectly here. And this is a nice one to work the tendons, like the tendons of the hamstrings coming across the knee joint here, tendons of the gastrocs, and another kind of opposite, hands doing opposite things. So as the ankle comes toward me, my other hand moves away. As it moves away, my hand moves toward me. It's not a deep stroke. It just works those, gently works those tendons. And a lot of people say it feels good, so I keep it in. You want to be careful you're not overly accentuating this. You don't want to strain their knee joint at all. Okay. For the vibration on the calf, I'm going to press the calf muscles, just basically press my hands in. It sort of pushes the calf muscle up, and then this little shimmy. And my hands are not moving over the skin. They're pressed tight against the skin, so they're not moving over the skin, but they're allowing the muscle to vibrate between my hands.
Like an up and down motion?
Yeah, so I'm doing this,
Uh-huh.
but not over the skin. Pressing in and doing this, and it vibrates the muscle between my hands.
And are you kind of like cupping the muscle?
No, my fingers are straight.
Straight?
Yeah,
Okay.
yeah. I mean, maybe slightly,
Gotcha.
but not anything too.
Mm-hmm.
And one of the things I think, if anything, I'm just seeing people kind of do this just too briefly. They'll just come in and just go, and then be on to, you know. So you want to do that enough so it actually feels like it's getting some positive effect. And the Effleurage, sorry, this is kind of chopped up as I'm speaking, so I apologize for that. And the back of the thigh, we're going to do some more Effleurage. You can do, and I'm just going to continue it up over the hip to the iliac crest there. You can do deep Effleurage with your hands. You could also use the edge of the arm here, and we'll do more of this in Bodywork 2. I mean, I'm going to use my body weight to just kind of sink in over the person, so I'm not pressing down, but I'm just leaning into it. I do not want to lean over the popliteal fossa. This is one of the endangerment sites because there's nerves and blood vessels here, and so you can avoid or just go lightly for effleuraging up the leg, or just go lightly over the popliteal fossa here at the back of the knee. And I'm going to start just above that, and the deeper you go, the slower you go. A little slow. And then as I get up to the ischial tuberosity or the sits bone, I have to lighten up, and then just, I can do like a swing out like that just to complete, and you can do that, you know, a few passes, and we go a little deeper each time. So the part that I'm wanting to avoid is this sits bone here, and we're also going to talk about the greater trochanter here, which is what you might think of as like your hip bone. And we're going to do knuckling. We're actually going to pass between these two when we do the knuckling, which I will do next. I like to sometimes just grab my thumb so my hands are moving in tandem. And here on the back of the thigh. How's that pressure, Jean? Is that okay?
That's very good, yeah.
And I don't want to knuckle obviously over his sits bone or the ischial tuberosity or the greater trochanter, the hip bone. So I'm going to swing my knuckles and go through them. and then I can swing back and do a nice, like, kind of curve around the top of the iliac crest, and then just open my hands and bring the back. Or, you know, you could even just leave your hands in the knuckling position. Either one. Got my thumbs. So as I get up here, I'm gonna go between the bony structures. I'm gonna lighten up a little bit too, just not totally sure I'm gonna miss them 100%. So, and then I just lean into those nice, big, fleshy gluteal muscles. And open my hands up and come back. You could also just work straight up the IT band here. And again, we'll do a lot more on this in the Bodywork 2. This other hand is just supporting, not doing anything, it's just holding. I have to lighten up as I come up by the greater trochanter, and I can also do sort of a one-handed, similar kind of sweep through here. Okay. Ringing. One of the things that I learned, and I think it's a good rule of thumb, is to not go farther than like halfway up the medial thigh. Just because it's a very private area. The skin on the medial thigh and on the inside of the arms is also thinner, so we don't want to be doing a lot of. Oh, I didn't do Petrissage yet, did I? I've skipped the Petrissage. I'll do that next. So let me just do the Petrissage. I have to kind of squat down a little bit to do the Petrissage on the outside of the leg, because otherwise my wrists are really at an odd angle. So if I do Petrissage, I'm going to do only about halfway up the inside of the thigh there.
When you say working from medial to center to lateral, do you do that?
Yeah, it's, do I say medial on this one?
Mhm.
On my old notes I had lateral to medial. So I don't think it really matters.
Okay.
Okay, and it doesn't really matter what order we do these things in, but so then you could do the knuckling afterwards if you want. The ringing is going to be like we did on the back. Fingers are facing the same direction. Just drawing the skin between your hands. And I'm going to angle quite sharply here to stay on the lower half of the inner thigh, but work the upper half of the outer thigh. So my hands are following the drape here. That's kind of a rule of thumb too. You don't want to, you want to be able to see where your hands are going basically. So, you know, if you've got an area undraped, then work on that area and try not to let your hands disappear under the drape, because sometimes you might get a surprise. Everybody might get a surprise. You want to see where you're going. And I'm going to do the hacking and vibration afterwards. I like to do that after I cover up the area. So to work on the hips, can somebody scroll down a little bit? A little bit more. Yeah, perfect. Okay. So you can just do some nice hand over hand effleurage, and I know my fingers are disappearing a little bit there under the drape. I'm just trying to keep it draped. So hand over hand. To review, the muscle fibers are coming off the iliac crest here and the sacrum, coming like this down to the gluteal tuberosity and the IT band down here. So the fibers are coming like this. So if I'm doing friction this way, or just actually it's like a deep effleurage, I'm going toward the fibers with the fibers here. Another good thing is to, for the person's comfort, is to try to go lateral to medial. So as I'm doing anything that's really working into the tissue, I'm actually working toward midline instead of away from midline. If you're working away from midline, you're kind of opening things up and it makes people uncomfortable. So we're gonna go more lateral to medial. I can work in circles along the iliac crest here to get some of this, some of the origin, muscle origin here. You can also work your thumb. If you find an area you feel like there's a muscle knot or tension, you can work that with your thumbs with some deeper friction. Is that pressure okay?
Yep.
An area I really like to work is at the greater trochanter here. That hip, do you mind pointing at the greater trochanter? There you go. Okay. So there's a lot of muscle attachments there. Havana's.
A lot of pressure.
That was what I know. You did good. So just circling over the top of the greater trochanter, getting those attachment sites can feel really good. And, you know, it can be a source of tension and pain. And even going from the greater trochanter, working back up toward the iliac crest.
So when you're knuckling, you're trying to avoid your trochanter, but when you're Petrissage, you want to go over.
We're going kind of just like right above it where the muscle attachments are. Yeah. You should have flight attendant. Yeah, so we're just kind of like that, sort of going right over the top of it. Yeah. I'm just trying to think if there's anything that's right directly on. I mean, it's, yeah, probably just more over the top. Superior, I should say. Let's use our anatomical language here. I should be. And then we can do some effleurage to end.
Are you always facing like this way, or do you ever face that way down the leg?
You can, we'll do, like when I say we'll do Bodywork2, we'll do more working in, like along the sacrum, you know, along the piriformis, and we'll do probably more of that.
But for now.
Yeah, and look on YouTube, there's all kinds of videos,
Okay.
you know, in terms of, you know, you'll find different techniques. So
Okay.
you'll find all kinds of techniques.
But for these ones, you generally stay that.
Yeah,
That way.
yeah, I am, just because we're kind of working this way along the leg. So to undrape, I'm going to lift at the knee, oops, with this hand, and I'm just going to pull straight back and undrape. And from here, I can do some vibration on the back of the leg. So it's similar to the calf, where hands come in from either side, and again, I want to stay on the lower half of the inner thigh and pressing the muscle up and vibrating between the hands. And I sometimes just work my outer hand up a little bit to get other parts of the thigh and glutes involved in that vibration. Okay. And if you want to do some Tapotemons and percussion, you can do that as well, avoiding the popliteal fossa. You do want to have a little bit of the bounce in the muscle. Is that pressure okay to you? Okay. Sometimes I'm noticing people are like, they're kind of afraid and they're just, and that just sort of feels like, you know, not much. Roots here. You can do the hacking, you can do the whacking if you like that instead. Some people feel this is a little easier for them, the coordination aspect.
Would there ever be a reason to do like cupping on the leg, or was that predominantly
It's
just for
pretty
the
much
lungs?
the lungs.
Okay.
Yeah, that's pretty much the lungs. You can do some gentle beating. The glutes are big muscles, and it actually works really well with the glutes. Okay, and that's everything I want to do there. For the foot, we have the pillow here just to help relax the ankles if you don't have the pillow. if you're pressing down at all, kind of compress the foot or the ankle into the table. If you, at this point, you can sit on the table if you like. And Gene does have a Band-Aid, as he told me, on his big toe from hiking. So I'll try to avoid that. So certainly there's a lot you can do on the feet. I mean, you could do like a whole hour on the feet, right? Well, Jesse, right, you could. If you got creative enough, you could do like a whole hour on the feet. And if you do, you know, for whatever reason, if you're just working on somebody's feet or their hands, it's also nice to include like the calf or the forearms, because certainly they're connected, and it just makes a much nicer foot massage. But we aren't doing just the feet this time. So I'm going to start with this kind of milking stroke. There's a little bit of a blister here. Is that being tender where I'm?
Oh, no, that's fine.
Okay. So applying oil to my hands, and then kind of milking the foot. Just drawing my hands down the foot. The foot's a little challenging because it's an odd shape, and it, you know, the ankle moves around. So often I'm just trying to kind of bolster with my hands as I'm working to keep the foot from moving around too much. Here my fingers are just supporting the heel, and you know, heels get calloused, so you may have to put a fair amount of pressure and press in a bit to work the heels. I like to circle around the ankles as well, go up the Achilles tendon. In reflexology, there are points that are behind both malleoli, the ankle bones, that correspond to the reproductive organs. So on the outside, it's the testes in males and ovaries in females. And on the inside, it's the prostate in males and the uterus in females. So this isn't, especially on the inside, is a contraindicated area if there's any chance of pregnancy. You know, in case of like it would stimulate uterine contractions or something like that. I think it's just a precaution.
What about like prostatitis?
It would be more indicated. Yeah, with reflexology, when you work the area that's associated with that organ, they've shown it does bring actually increased blood flow to the organ. So that would be indicated. And if there's a tender area where you're working, it could indicate that that person has some, you know, imbalance or something in that organ. So fingers, thumbs rather circling. And down to the ball of the foot here. And I like to circle off the toes. I'm not going to circle off the big toe because of the Band-Aid, but just kind of between my thumb and first finger circling.
How much pressure?
Not a lot. I don't know how much to describe to you. It's not a lot of pressure. It's not like my hands are getting sore tired. I do like to do some pressure points along this. There's like a little ridge here at the base of the toes. I always think it feels really good to get that work. You guys you can practice on yourselves too, of course. In Ayurvedic medicine, doing oil massage on the feet is really good for sleep problems. So like warm sesame oil, really good for if you have sleep disturbance. You can practice foot massaging yourself. I go along the outside of the foot between my knuckle here and my thumb, just making circles on the outside of the foot. If I get to an area that feels obviously calloused, I will apply more pressure, just because it feels like they're going to need more pressure to even feel anything. You can also go thumbs across these long tendons in the foot, across this way. knuckling on the foot is a little tricky, and I don't want to just like drag my knuckles down their foot. That doesn't necessarily feel good. But what I'll do sometimes is just kind of work my knuckles into especially the arches and where those long tendons are, because I can kind of like hold the foot with this hand and then just get into that arch. So get in a little bit more deeply. Okay. And then I'm going to do the Effleurage, milking off the foot to end. And we'll do the top of the foot next week. So I would do like one leg and the other leg and then the foot and the foot. And then next time we're going to have the person turn over and then we'll start on the top of the feet. Then you can wash your hands and go on with the rest of the massage.
So you do leg and foot and then leg and foot?
I'm just doing leg and leg.
Oh, okay.
And then foot and foot.
Okay.
Yeah, so if you want to wash your hands after you're done with the feet, rather than going right next to the next.
Got it.
Yeah.
Is the foot kind of an exception to how you like to generally go to the heart, just because the mechanics of it?
Yeah, I mean, it's all kind of away from the heart, so if I go up the
Or toward the
leg,
heart.
yeah, if I go up the leg, I'm going to go pushing toward the heart, but it's pretty much the end point. Yeah, so even though I'm going from here to here, I'm kind of, yeah. It seems like the legs are so much more susceptible to like varicosities and stuff more than the foot for whatever reason.
Leg
Just barely hanging in there. Any other questions?
Just clarification, for the calf, when you're doing the foaling,
Mm-hmm.
I thought you said work from
I-
there to,
Yeah, I went up the calf and then
And
I'm
then-
pressing toward the heart, but I'm kind of coming back towards
down.
myself.
oh, okay,
Yeah.
I see, so you're,
Yeah, so
Circling.
effleurage up and then do fulling kind of
and
backwards.
back down.
And the
Okay.
same thing here with the fingers on the sides.
Mhm. Gotcha.
Okay. So we have an odd number right now, so somebody's gonna have to work. Jean, you're gonna have to get massaged again, I'm sorry.